Hello and welcome, you are watching Step Up Medicine's video on the mechanics of breathing. Ever wonder how air gets into your lungs with no pump? In this episode, you'll learn how pressure drives breathing, the roles of compliance and resistance, how surfactant helps prevent collapse, and what changes in disease.
Let's start with how air moves in and out of the lungs. Alveolar. Lungs air flows from high pressure to low pressure. Lungs gull to mun. That's the basic rule. Lungs gull to mundur. During inspiration, alveolar pressure must drop below atmospheric pressure. Atmospheric pressure at sea level is about 760 millimeters of mercury. So if alveolar pressure drops just slightly, even by 1 millimeter, air flows into the lungs. How does alveolar pressure drop? By increasing thoracic volume. This is done by the diaphragm and intercostal muscles. Lev 50 sala, Levic voltres, Lev 50 sala, Lev 50 sala, Lev 50 sala common, Lev 50 sala, Lev 50 sala, Lev 50 sala common. Intala pressure becomes more negative. Lev 50 sala, Lev 50 sala wes, Lev 50 sala, Lev 50 sala common, Lev 50 sala shuls, Lev 50 sala coltres, which increases lung volume and decreases alveolar pressure, allowing air to flow in. During expiration, the opposite happens. The diaphragm relaxes, the lungs recoil. Alveolar pressure rises slightly above atmospheric. Air flows out. So to summarize, inspiration, alveolar pressure is less than atmospheric. Expiration, alveolar pressure is greater than atmospheric. Intrapleural pressure stays negative and becomes more negative during inspiration. These pressure changes drive ventilation, breath by breath. The diaphragm is the primary muscle of inspiration. When it contracts, it flattens. This increases the thoracic volume, which lowers alveolar pressure and draws air in. The external intercostal muscles also help lift the ribs. For forced inspiration, accessory muscles in the neck assist. Expiration at rest is passive. The diaphragm relaxes. Elastic recoil pushes air out. Forced expiration uses abdominal muscles and internal intercostals. Now let's look at the pressure between the lungs and chest wall. This is the intrapleural pressure. It's normally negative, around -5 centimeters of water. Why? Because the lungs want to collapse inward, and the chest wall wants to spring outward. Trialar. This creates a vacuum that keeps the lungs expanded. The transpulmonary pressure is the difference between alveolar pressure and intrapleural pressure, because it's what actually keeps the alveoli open. If this balance is lost, like in pneumothorax, the lung collapses. Compliance is how easily the lungs expand. Sure compliance means the lungs stretch easily. Wesebehold like in emphysema, but they don't recoil well. Low compliance means stiff lungs, like in pulmonary fibrosis or ARDS. Mathematically, compliance is the change in volume over change in pressure. Lungs and chest wall both contribute to total compliance. Let's talk about surfactant. The alveoli are lined with a thin fluid layer. This creates surface tension, which can cause the alveoli to collapse. Surfactant is made by type 2 alveolar cells. It reduces surface tension and prevents alveolar collapse, especially during expiration. Without surfactant, small alveoli would collapse into larger ones. This is called atelectasis. In premature infants, lack of surfactant causes neonatal respiratory distress syndrome. Airflow also depends on resistance. Resistance is highest in medium-sized bronchi. It decreases in the small airways due to parallel branching. Poiseuille's law tells us that resistance is inversely proportional to the fourth power of radius. That means small changes in airway diameter can make a big difference in resistance. In asthma, airway narrowing increases resistance, making it hard to exhale. Bronchodilators help by relaxing smooth muscle and increasing airway diameter. Let's review. Breathing is driven by pressure gradients, created by muscle movement. The diaphragm increases volume, lowering pressure, and pulling air in. Intrapleural pressure is normally negative, keeping lungs expanded. Compliance measures lung stretchiness. Surfactant reduces surface tension. Resistance depends on airway diameter and increases in obstruction.
Here is a quick question to test your knowledge. What is the primary muscle of inspiration? A. Diaphragm. B. Internal intercostals. C. Abdominals. D. Sternocleidomastoid. Drop your answers in the comments below. If this helped clarify your basics, like and subscribe for more high-yield videos. Up next, alveolar ventilation and dead space. Thanks for watching, and keep stepping up your knowledge.